Hello.
Hi, how are you today? Hand hygiene. How are you today?
Good.
Good. My name's Lindsay. I'll be your nurse today, okay? I'm going to be in here for about maybe 20-30 minutes or so. I'm going to be doing a head-to-toe assessment on you, okay? To get a better idea of why you're here, okay?
Okay.
All right. Can you go ahead and tell me your name and date of birth for me?
Mike, 615.
All right. Good. Do you have any allergies at all?
Nope.
Okay, good. I can tell that the patient is in no signs of acute distress. I know I already asked you what your name was, but I have a couple other questions to ask you, okay? Do you know where you are?
Home.
Okay. Do you know what the year is?
2020.
Okay. And do you know why you're here today?
To help you.
Okay, good. So the patient is alert and oriented ×4. His facial expression and mood are appropriate to the situation with clear speech. So now I'm going to go ahead and I'm going to look at your skin, okay?
Okay.
So I can tell that your skin tone is even throughout, appropriate to race. I don't see any wounds, lesions, or any incisions at all. I can also feel that your skin is nice, warm, and dry there. Go ahead and look at your nails, okay? Alright, got a nice pink bed there. Thick cap refill of less than 2 seconds. Alright, you go ahead and put your fingers together like that for me real quick. Good, so no signs of clubbing. So now I am going to go ahead and look at your hair here, okay? Your head. I don't see any wounds. There's no infestations of any kind. Okay, good. So now I'm gonna go ahead and take a look at your eyes, okay? I can see that there's no redness, no drainage of any kind. Your sclera is nice and white. I'm gonna go ahead and pull this down here. Can you look up for me? Good. Your conjunctiva is pink and moist. So now I'm gonna go ahead and shine the pen light in, okay? Just look straight at me. Good. Do the other side. Good. Your pupils are round, or equal round, reactive to light with accommodation at a size of 3 to 5 millimeters. Now I'm going to go ahead and I'm going to do cranial nerve number 3, 4, and 6. I think I'm going out of order. But I'm going to go ahead and do cranial nerve 3, 4, and 6, okay? I'll go back. All right, can you just look at the end of my pen light here and just follow it, okay? Without moving your head. Good. Good. And last one, I'm gonna go in. Good. Okay, so now I'm gonna go back to the cranial nerve 5, which is under head, neck, and something else. I can't remember its head. So I'm going to go ahead and assess cranial nerve number 5, which is trigeminal. So I'm going to go ahead and have you close your eyes, okay? And I'm going to just put this against your face. When you feel it, just let me know, okay?
Yep. 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 Yep.
Good. Now I'm going to go ahead and assess cranial nerve number 7. Can you go ahead and smile for me? Go ahead and frown. And raise your eyebrows. Good. And cranial nerve 7 is facial nerve. So now I'm going to go ahead and I'm going to do cranial nerve 11, which is your spinal accessory nerve. So I'm going to go ahead, here, sit up just a little bit for me if you don't mind. Go ahead and push resistance against my hands. Good. And go ahead and push your head against my hand. Good. Other side. Good. Okay. So now I'm going to go ahead and I'm going to move to your ears, okay? Based on looking at your external ear, I don't see any redness or any discharge of any kind, drainage. I'm going to go ahead and do a whisper test, okay? I'm just going to stand on the side. I'd be usually a little bit further behind. The whisper test is for cranial nerve 8, and I can't remember what the name of it is. Okay. But I'm going to go ahead and perform a whisper test. Pretty much I'm going to whisper it in the behind his ear, and if you can repeat it back to me, then he passes.
Blue.
Okay, you can do the other side real quick.
Yellow.
Okay, good. All right, so now I'm gonna go ahead and I'm gonna do your nose now. I gonna look up here. Alright, good. No signs of, well, his nose is symmetrical to his facial features. There's no deformity, there's no inflammation, there's no drainage of any kind. So now I'm gonna go ahead and do nasal patency. So can you cover one of your nostrils for me? Breathe in, and the other one. Good. Both ears are, he's a little stuffy, but normally nasal patency is bilaterally. Okay. Now I'm gonna move to your mouth. Okay. You can go ahead and open your mouth for me. Okay. Good. You can see that your lips, your tongue and gums are all pink, moist, and intact. Oh yeah, now I need to do your cranial nerves 9 and 10. So I'm gonna go ahead and have you say ah. Stick your tongue out though. Oh, do it one more time. All right, good. I can see that his uvula rose when he did that, and it's midline. Can you swallow for me? Good. So his cranial nerve 9 and 10 are intact. 9 is glossopharyngeal and 10 is vagus. Okay, so now I'm going to go ahead and I'm going to move to your respiratory system, okay? So I can see that you're not using any accessory muscle use, you're not in any respiratory distress. So I'm going to go ahead and I'm going to auscultate lung fields anteriorly and posteriorly in a side-to-side fashion over bare skin, but I'm not going to take his shirt off. Okay, so here, right upper lobe, left upper lobe, right middle lobe, left lower lobe, right lower lobe, and left lower lobe. Okay, now so I'm going to do it posteriorly. Okay. All right. Right upper lobe, left lower lobe, right lower lobe, left lower lobe, right lower lobe, and left lower lobe. Good. Okay, so your lung sounds were clear on auscultation. So now I'm gonna go ahead and move to your cardiac, okay? I'm gonna go ahead and check your carotids, but I'm gonna do it one at a time, okay? Good. All right, carotids have a regular rate and rhythm 2+ bilaterally. Check and see if there's any JVD, which there is none. Good. So now I am going to Now I'm going to auscultate cardiac areas, first with my diaphragm. Sit up a little bit straighter, that way I can get to it a little bit easier. Okay. Okay. Or my diaphragm's on. Okay. So, it's aortic, second intercostal space, right sternal border. Pulmonic. Second intercostal space, left sternal border. Then I got Erb's point, which is third intercostal space, left sternal border. Tricuspid, which is fifth intercostal space, left sternal border. And then I have mitral, which is fifth intercostal space, mid-clavicular line. Okay, so now I'm going to do it with my bell. Alright. Aortic. Pulmonic. Erb's point. Tricuspid. And mitral. Alright, good. S1 and S2 were heard throughout. No murmurs noted. Now I'm gonna go ahead and check your radial pulses, okay? Flip your arms over for me.
Just fix my
Oh, sorry. Good. Radial pulses have a regular rate and rhythm with 2 plus bilaterally. Now I'm going to go ahead and I'm going to check your pedal pulses here. Don't know if you guys can see me or not, but I'll just make sure I talk loud. Okay, so I got his Doralis pedis and I'm feeling them bilaterally. I can kind of feel them. Okay. And then I'll do the same, the posterior tibial bilaterally. And I can kind of feel that one too. Usually if you can't feel them, you'd get a Doppler, but I don't have a Doppler here, so yeah. Okay, so I'm gonna go ahead and move on now to GI, okay? I'm gonna inspect your abdomen, but I'm gonna go ahead and pull this down for it. Lay as flat as you can. Thank you. Okay, so looking at his abdomen, I can see that his contour is flat. His umbilicus is midline, and everything looks symmetrical. So now I'm going to go ahead and I'm going to auscultate bowel sounds. Okay. Starting with the right lower quadrant. Moving to the right upper quadrant. Moving to the left upper quadrant. And finally, the left lower quadrant. Okay. So normally I would auscultate bowel sounds for a minute in each quadrant. And if I heard if I did not hear any bowel sounds, I would listen in that quadrant for an additional 4 minutes before notifying the physician. So now I'm gonna palpate, sorry. I'm gonna palpate lightly in the right lower quadrant, feeling for any masses or anything like that. Right upper quadrant. Left upper quadrant, and left lower quadrant. All right, good. Any tenderness or anything with that? Okay, good. I didn't feel any distension either. So I'm gonna go ahead and have you sit back up, okay? Okay, good. So now I'm gonna go ahead and I'm gonna move into your musculoskeletal system, okay? So I'm gonna do inspection, palpation, and range of motion, and then muscle strength, okay? So I'm gonna go ahead and I'm gonna start with your temporomandibular joint. I can see that it looks symmetrical, there's no deformities of any kind. I'm gonna feel that there's no tenderness or anything or pain when I feel it when I put on that. Okay, good. Can you go ahead and open your jaw for me? Good. Go ahead and close it. All right, good. No crepitus felt or heard. You go ahead and do muscle strength now, so can you open up your jaw against my hand? Good. All right. So now I'm going to do your shoulders, okay? And they look symmetrical here. It doesn't look like there's any deformities of any kind. Go ahead and feel here, okay? Is any pain?
No.
No? Okay, good. All right, so now I'm going to go ahead and have you stand up real quick. All right, so I'm going to have you circumduct your arms, and I'm showing him how to do it, since they probably don't know. Good, good. Range of motion is full. You go ahead and stop. Range of motion is full bilaterally. You can go ahead and take a seat. Okay, so now I'm gonna do muscle strength, okay? I need to sit up just a little bit. Can you push up against my hands? A little bit harder than that. There we go, good job. Muscle strength is 5 bilaterally. So now I'm gonna go ahead and I'm gonna move down into your hips, okay? So I'm gonna go ahead and put this back for you. You can lay all the way back for me. Thank you. Okay. So looking at his hips, I know you can't see them, but they are symmetrical. There's no deformities that I can see from here. So I'm gonna go ahead and palpate, okay? No pain?
No.
Okay, good, good. Okay, So now I'm gonna test your range of motion, okay? So I'm gonna need you to lift your foot up. Good, down. Good. Can you pull your leg out this way as far as you can? Good. Can you bend your knee? All right, go in and out. Good. Go ahead and lay. We're gonna do the same thing with this one. Lift your leg straight up and down. Good. All the way out. Good. Then we're gonna go ahead and bend your knee. Go in and out. Good. All right, full range of motion there. Perfect. Bilaterally also. So now I'm gonna test your strength here. Ooh. Sorry, I tripped over the puppy dog. Can you go ahead and push out against my hands? Harder. There we go, good. Can you push in? Hard as you can. Good. Go ahead and pull in. Good. Can you push out? Good, okay. Good. Okay, I'm gonna move this just a little bit so you can see the feet there. Okay. So now I'm gonna go ahead and do your feet, okay? I'm looking at your feet, everything looks symmetrical. I don't see any deformities or any lesions of any kind. So now I'm gonna go ahead and feel. It's really good to get down in here and feel all these bones, since there's so many of them. No pain, no tenderness,
No.
nothing like that? Okay, I don't feel any crepitus or anything or hear any while I'm palpating. Okay. Now we're gonna do range of motion, okay? So try without moving your hips, moving your feet out. And then in. Good. And then can you touch your heels together? And then touch your toes. Perfect. Good job. Can you go ahead and pull your feet against my hands? And push. Good job. All right, so I'm gonna go ahead and take this, put you back up. Okay. So now I'm gonna test your gait, okay? So I'm gonna need you to stand up if that's okay. Got it? All right, cool. I'm gonna do the Romberg's test on you, okay? So I need you to put your feet together, your hands by your side, and stand straight up. And go ahead and close your eyes for me, okay? So the Romberg test, I would have my hands extended also, just to make sure he doesn't fall or anything like that. I would count for 20 seconds to make sure that he doesn't move or anything like that. And if he does, I would make sure I stop and note that. But he seems pretty good. So he went ahead and you're good. You can go ahead and sit down. He passed his Romberg test. All right, good job. All right, so we are all done here, okay? Are you in any pain at all?
No.
No? Okay. So I would make sure that the bed is in the lowest position. It was locked. The side rails are up, and your collet is in reach. Okay. Thank you for your time. If there's anything else I can get for you, please do let me know. Okay.
Okay.
All right. And then I perform hand hygiene.